Ready to go!
Alrighty guys, I promised you that I was going to film all of the behind the scenes stuff with my shoulder. I'm here at Dr. Kenneth Cutbush's practice this morning, about to meet the man, about to have the examination and hear what's actually going on. I know I've had a lot of YouTube comments, a few people have tried to take a look at images for me, and I appreciate all that, but we're going to find out for real now what's going on. So let's get underway. Kenneth, thank you so much for having me here.
My pleasure.
We're actually doing this again, YouTube. The camera stopped, but it's alright. Anyway, and it's your birthday. So
Yeah, it is.
I can't believe you came in on a birthday, but thank you so much. My shoulder, literally, as you're aware, I'm the second arm wrestler, Phil Rasmussen.
Yeah.
He's the president of the Australian Arm Wrestling Federation. He's the first.
I didn't realize he was the president.
He is. Did you know?
No, I didn't know that.
Yeah. He's a good man, but what did he do? He's super.
I had a big rotator cuff tear, big supraspinatus tear.
Yeah.
So I did a repair for him and grafted it and fixed it up for him.
He's actually said to me that he feels his shoulder is more secure now than it was before.
Yeah, that's a good result.
And so I'm actually excited, thinking like I'm going to get an upgrade if I have surgery. Anyway, so the story of what happened for me.
What happened?
Was essentially, I was preparing for an opponent named Gunter Bajkovs. He's a super heavyweight Latvian arm wrestler, 6'4", 130 kilos, much stronger than me. And what that meant that was my style of arm wrestling against him, instead of being like this, was going to be deliberately exposing my shoulder like to the maximum of the torque of all my joints. Mm-hmm. And so for a month and a half leading up to that match, I was deliberately allowing my opponents to get me to that position, and I was working really hard. I never felt any one pop or anything like that. It just gradually, over the month and a half, seemed to feel loose. I started to feel a lack of security and stability in my shoulder, and when I would engage under pressure, not that much pain, but when I would release, it would come back in. And then I started just everyday life picking up something and be like, oh, what's going on? Couldn't pick my daughter up, just to put her on a stool or something like that. So
You got pain as you lifted her up, did you?
Yeah. So I would have to cuddle her to lift her up.
Yeah, right.
But at the same time, sometimes I'm strong there with no pain, and then sometimes I have pain, and then it seems to be looseness is what I feel like. It feels risky when I arm wrestle at full tension. I feel nervous, like something could just go. That's what it feels like.
Yeah, right.
To me.
Feels insecure.
Feels insecure. It doesn't feel like it's staying in its correct spot. Feels like.
So more insecurity than pain.
Yes. Yeah. Right. The pain, no higher than like a 6 out of 10 at its absolute worst for a very short moment, where if I get in the wrong position, but it feels like it. If it goes into that, I feel like if I was under full tension of an elite match, and I went into that painful position, like something could rip off. I don't know. Yeah. But without a single moment, I guess I overtrained it. I pushed it. At first, I started trying to just rehab. I started doing external rotation and all these different things, and was expecting it to get better, and it just progressively kept on getting worse. And I thought, time to go get some scans.
Because when was the injury?
Probably 2 to 3 months ago.
And before that, you had no shoulder.
No shoulder
Shoulder
problems.
was totally fine.
Yeah.
You never dislocated it. Never come out water skiing or playing rugby or anything.
I played tennis for all my childhood, from 7 through to 18. Mm-hmm. My right shoulder sits lower than my left. Mm-hmm. I think that was from tennis, but no pain, no injuries, no surgeries, nothing like that. So.
And has this stopped you arm wrestling?
No.
Still
Goodness no.
So you're still training?
I actually think I'm at my strongest ever, because arm wrestling it's a sport where even a gentleman named John Brzenk, greatest arm wrestler of all time, he tore his labrum at I think age 26. His side pressure is significantly less than other arm wrestlers of his same sort of caliber. Yet he's still the most dominant of all time, and that's because his hand and wrist. So if I'm just arm wrestling more with an independent use of my hand, wrist, and pronation than committing shoulder. So I actually feel like I'm better right now. But when I say I'm better, it's just that I've developed new strengths in other areas.
So did you have that match that you were training for, or is that still coming up?
Never had the match, but I never had the match because of the state COVID laws. I couldn't get into the state in the end. But I probably wouldn't have done it with this. Like I couldn't, because that guy is too good for me to arm wrestling this way. I would have to do this, and I'd be too scared.
So you haven't competed since that injury?
Not in a tournament.
And was it one particular event, or was it just the training that you were doing over?
It was just, I think it was the training over there, about that
time.
month and a half. Yeah, there was no one moment. It just continuously, gradually felt worse.
Yeah.
More inflammation. I started having to, I started taking too much ibuprofen to deal with it and all that sort of stuff.
Right.
And yeah.
Okay.
Yeah.
Let's have a look at your shoulder then.
Alrighty.
So Ryan, pop your shirt off and please, mate. Just stand here for me.
Singlet on, right?
Singlet's good, yeah.
Right. See if my right shoulder sits lower?
Yeah.
What's
It's
that
usually
about?
postural.
Okay.
Usually postural.
Yeah. I'm terribly kyphotic. And arm wrestling doesn't help. I'm always doing this.
Are you right or left-handed with your arm wrestling? Just right-handed?
Just
Because
I
Phil was telling me he
have a look at the
does
difference
both.
in the forearm.
Wow, huge difference.
You've seen it before, YouTube. Yeah, but 98% of my training focus is on my right.
Yeah, right.
It's the one that pays the bills.
Yeah, right. Good.
Mm.
Okay, so if you just do what I do,
Mhm.
don't hurt yourself, just want to see what you can do comfortably. Lift up for me.
I can get all the way up, and it's not.
But you're a bit hesitant with it. Whereabouts is that kicking?
They're here.
About there?
Yeah.
And getting soreness?
Yeah. 3 out of 10.
Does it get worse or better as it goes all the way up?
Right at the top a little bit better, but
Yeah, right, okay.
yeah.
Alright.
Yeah.
Back down to here and then up in the front.
So
Okay.
about here is where the pain starts, but it's like I said, it's not unbearable pain by any means.
Back in here. And twist out. Yeah, good. You're a little bit down on that side compared to that side.
And I feel that this chronically, arm wrestlers struggle to straighten their arms. Like if you look at someone who's been arm wrestling for 30 years, they're walking around like this. They literally, Dennis Saplenkov, Devin Larratt, and Michael Todd, they can't straighten their arms. So my left, if I put my humerus on the table,
Yeah.
my left, no worries. If I put my right humerus on the table,
Yeah, right.
yeah. So
Elbow arthritis.
yeah, it just shortens up.
Yeah.
Or,
A bit of arthritis.
Yep.
Up behind your back now?
Oh yeah, this one's no good.
That's sore on the shoulder, is it?
That's sore in it.
And then what about this side?
This one, no worries, I
Not
can right
bad,
up
isn't
in
it?
between the scapulars.
I'm
Easy.
going to come over here.
Okay.
And just stand here for me. Now you saw here over your AC joint?
No.
Not at all. Does that worry you?
Nope.
If I did that, would that worry you?
Yep.
A little bit, alright. Let's just do it again. Not too bad.
Not
though.
too bad, no.
Okay. Hold here.
Yep.
Now push up towards the ceiling.
Yeah, it's painful.
Bit sore?
Yep.
Pop your elbow down here for me. Push me away. It's okay?
Yeah, that's alright.
Okay. Pop your wrist on your tummy now. Elbow forward. Push backward on your tummy. Yeah.
Oh yeah,
That
not,
bit sore?
not that painful, but it feels loose. That's one of those things that make it feel like it's moving around.
This is, so we've looked at supraspinatus and infraspinatus. This is now subscapularis.
Okay.
So that's the belly press test. So pop your hand on your shoulder there. I want you to put your forearm parallel to the ground.
Already painful.
Is that sore?
Yeah.
Yeah. Look this much. No, hold it up there. We've got something worse to do. Push down.
Yeah,
Sore?
yeah.
That's really sore,
Yeah.
eh?
It's not like huge amount of pain, but it's clear that that's
That's
something.
usually upper subscap. Now
Okay.
round behind your back for me. Back to here. If you can, push directly back against it.
Oh yeah.
Sore?
Yeah. So.
Yeah, right. Okay. That looks like subscap a bit. Pop your hand down. Now pop your hand out like this for me, Ryan. That's it. Push up. That's okay?
Mhm.
No, we're just looking at your biceps now. Tuck in. Stop me turning your wrist.
Okay.
Stop me.
Which way are you going?
This way. Sore?
Yeah. No.
Not at all.
No, that's fine.
Right, let's just try it again. I really want to check this. I'll
Okay.
show you why soon. Keep your elbow straight. Straight out. Push up. Okay, what about up here? Push up. Turn
A
over.
little bit.
Push up. Okay, alright. Look, we'll do a couple of tests for your AC joint. Not too bad. Push up towards the ceiling.
A little bit of aggravation.
It's all there. Okay. And you're not tender over your AC joint, so I'm not expecting those to be positive. Okay, we're just going to look at instability now. Does that worry you?
Yep.
Yeah. So That's anterior instability there. What about this one?
Yep.
Is that worried?
Yeah.
Yeah, that's inferior. Hold that push up. We've done this one before already. That's okay?
It's okay.
Yeah, but just look at this, because we'll talk about this. That worries
Yeah,
me.
yeah.
The fact that you don't like that.
Yeah, it's not nice.
Now, how flexible are you?
Not very.
Not at all. Can you push your thumb down? What
No.
about your fingers back parallel to your forearm? No, we know you're always huh?
My left, I can do it. I can do it on my left. But
Yeah, you are a little flexible. What about just twist your arms out again? We'll just look at this side. Yeah, you don't. Yeah, that's fine. You don't get hyperlaxity. You don't meet the criteria for hyperlaxity.
yeah.
All right.
Okay.
Take a seat.
Awesome. Let's get this back again. There we go, YouTube. I'm not very flexible. That's for sure. Alrighty, let's have a look at these things.
So looking through your scans before you came in, I was expecting your biceps to be a problem. And what we saw from your examination was the biceps doesn't really look like it's a problem. The biceps tests are the one where you're looking, pushing forward like this, and the other one is this one twisting here, Yerkeson's test. Speed's test and Yerkeson's test.
Okay.
They didn't worry you at all.
Yep.
The things that worried you, and I wasn't really quite expecting it, was your subscapularis testing. Subscapularis testing was really positive.
Yep.
Belly press test, the bear hug test, and the Yerkeson lift-off test. Or it's not the Yerkeson lift-off test. It's the other the lift-off test
Yep.
was positive.
Yep.
And so we'll look at that with your scan. And the other thing was the instability testing. Your instability testing was positive.
Okay.
So if we look at your MRI scan, let's just take to here first. So this is your MRI. You can see here, this is the rotator cuff coming across here. That's the supraspinatus tendon there. This is the humeral head with the ball, the socket, the point of the shoulder. That's your acromion there, the outline of your skin, and that's the deltoid coming down there. Are you getting a lot of glare there?
It's not too bad. It's all right.
I'll just close this because it might differ.
Yeah. Yeah, I did a lot of Google research trying to work out what on earth these images. I'm looking up torn labrums and torn thingos, trying to work out what I'm looking at. But
Do you want me to start again?
no, that's right.
This bit?
Yeah.
So we can see here, this is your supraspinatus tendon coming in here. And it's essentially intact. A little bit of high signal back here, just on the undersurface of the infraspinatus. It's not anything significant. Your AC joint up here looks pretty good. It wasn't tender. The AC joint is often cause of pain when you lift your arm up and get sore as you lift it up, but it's not what's causing the problem here. You've got a touch of arthritis. You can just see it just in here, a little bit of a spur happening here. Otherwise your shoulder's pretty good. If we go through to this, so this is a cross section through your shoulder. This is the top of the arm bone, that's the ball, this is the socket here. Your shoulder blade is here, spine is back about here, and your lungs are up here. You're looking from your feet towards your head. This is the back of the shoulder, that's the front of the shoulder.
Yep.
If we look at your rotator cuff, this is your subscapularis across the front of the shoulder. Remember that was sore when we were testing it.
Yep.
You can see a biceps tendon here, which I'd been worried about. Rotator cuff around the back. This is teres minor or infraspinatus around here, and that's your deltoid there. You can see on this scan, the fluid in your shoulder joint is white, so water is white on this scan, and that's what we're looking for. You can see why I was worried about your biceps tendon. There's a whole lot of fluid around the biceps tendon. So that's the bicep tendon there, the little black round thing.
So that in a relative scale to the normal amount of fluid, should it...
A lot, yeah.
Okay.
We don't normally see any fluid at all.
No fluid at all. Okay.
So that's right down the bottom. You see all of that is joint fluid, synovial fluid around the bicep tendon. As we come up, still quite a lot of fluid around it. However, you can't see any splits or tears in it, but I was suspicious about it. The other thing to just to mention, we always look at the back of the humeral head if we're looking at patients might have instability, looking for any dents. If someone dislocates their shoulder, it comes out like this and bangs back against this corner of bone here. And that bone is harder than that bone, so like diamond scratches glass, that we usually dent that, and we get what is called a Hill-Sachs lesion in the back of the humeral head. I can't see one there that's obvious.
Okay.
Labrum here at the back, that's intact. That's your posterior labrum there, that little triangle there. This is the outline of the bone. That grey line there is the hyaline cartilage, the joint lining cartilage in your shoulder. You can actually see the two layers. Quite a nice MRI scan. You can see the layer of hyaline cartilage on the humeral head and on the glenoid, and in between the joint fluid you can see a little sliver of it coming through there, separating the two layers out. This is the labrum at the front of the shoulder. As we go down, we're not seeing any obvious tears. What we're looking for here is a little white line coming underneath here, with the white line being fluid seeping into a tear that's sitting across there. The only thing I would say is it looks thicker. It just looks a little suspicious, but we're not seeing any discrete tears on the MRI scan. And that's where I'm sort of suspicious here, because with your instability testing, it was suggesting that your shoulder was wanting to go out this way, and so it's specifically looking for a tear here. The Subscapularis was unusual in its testing. All we see around here is a lot of fluid up around here, and that's fairly non-specific. There may be a little split in here. See that little white line in there? That's fluid in the supraspinatus tendon. Good tendon is black because it doesn't have any fluid in it at all. It doesn't have any water content in it, so it's just pure black. Once we start seeing fluid in it, suggests that there's some problems with it. Just reset that. So if we go to this here, so this is 90 degrees. We're looking here at the top of your arm bone. You can see the humeral head coming into view. If you keep going in this direction, over here will come through your shoulder blade, then to the spine. If you went far enough, you'd come to the other shoulder, just to orientate you. This is your biceps tendon here. Remember, we've been suspicious. Again. Yeah, a lot of white. There's a lot of fluid around the bicep tendon. Biceps quite thick, but there's no splits that we can see in it. This is your subscapularis here, just coming into view here. It's all streaky, but it's not obviously torn. It is intact, so if we're dealing with anything, it's more likely tendonitis than an obvious tear. You can see some fluid up here in a recess. You can see a little debris in it as well. It may be that you've got some irritation around your subscapularis. And of course, we're looking for tears in the labrum here, but they're not usually easy to see on this. This is the same view, but a different sequence. On this sequence, the fat turns up as white and fluid doesn't. Fluid turns up dark. So we just see some different different characteristics. What we're looking for is muscle quality around the shoulder blade, because this is the rotator cuff musculature. This is teres minor, infraspinatus, supraspinatus. This is subscapularis here. Good quality muscle. If you have a big rotator cuff tear like filled in, and it's been there for years, which it wasn't with Phil because it was acute, you start to get a lot of fatty infiltration here, which you're not getting, and there's no evidence of denervation or anything like that. Yeah, so the MRI scan doesn't give a specific answer, but we're suspicious about a couple of things with your shoulder.
So you mentioned, you said tendonitis or?
Yeah, there's something irritating your subscapularis, and you've got instability in your shoulder. We know that from the examination.
So the instability, what do you? What are the possibilities there? You think
you've probably got a labral tear down at the front of the shoulder, and we just can't see it on the MRI scan.
Okay,
it's just beyond the resolution of the MRI.
Here we go. Well, it's kind of good that I expected. To me, that report sounded better than I expected it to be honest.
So the next thing we look at is a CT scan.
Okay, CT scan.
And so we start with these axial slices. Just like the MRI scan, they're nothing remarkable there. And then what we do is we get them to do a 3D recon. So you can see this, that's a 3D recon of your shoulder. They actually do a 3D recon of your shoulder and humerus, and then they actually separate them and give them to us individually. And they're extremely helpful. So what we're looking at here is the end, that's the socket with the humerus taken off. And this is your right shoulder. What we're looking for is any bone loss down here, any chipped bone off or anything like that. We're not seeing that. Often guys that have had a big dislocation have lost a chunk of bone from down here, and that's really significant because it changes the sort of surgery that we need to do for them to fix them. But we're not seeing that with you. That all looks pretty normal. And if we can compare it to your other side, because we got that at the same time in the same scan. Let's unlock that.
So the one on the right of screen is my left shoulder?
So this is your right shoulder, the bad shoulder, and that's the good shoulder. And what we're looking at is just, we want to see this, they're not quite going to play together. But what we want to see is this pear shape to it. It's wider at the bottom than at the top. And that's a normal shoulder morphology, and that's what we want to see. And we've seen that in both shoulders, and they're both very similar. We go to your humeral head, so that's the right side. Just pull it down. You'll notice just a touch of the arthritis. You can see just a little bit of squaring around the edge of the humeral head. This is the articular surface, that's all covered in cartilage. You can see just a little bit of squaring happening, and it's very similar to the other side. No dents here at the front of the shoulder, like for a reverse Hill-Sachs lesion, and no obvious Hill-Sachs lesion around the back of the shoulder. Maybe, possibly a little bit of depression, but nothing obvious, and nothing you could say conclusively was a sequelae of a dislocation or anything like that.
Yeah, I definitely haven't dislocated or anything like that.
Yeah, you'd be surprised.
Yeah. Oh, really?
Yeah, I see people all the time clearly dislocated the shoulder. And
Oh, wow.
No idea
And they've never...
done it. No recollection at all.
Wow, okay, there you go. Oh, yeah. Well, arm wrestling does put weird pressures on the joint. It's like... It's not, as you know, it's nothing linear about the movement. It's the side pressure involved and the torque that goes through the elbow and the shoulder. I don't think there's another sport that asks an athlete to do that to that same extent. So, yeah, it's interesting. It's fascinating images to see that sort of stuff. But honestly, it's way better than I expected, which is good. What do you reckon from that? Is it all? Is the possibility of that labrum still not intact, or is it?
Yeah, what's troubling is that sense of instability.
Yep.
That's unlikely to go away. You can certainly, the first thing is a rehab program with the physios.
Yep.
And what they try and do is teach you proprioception so that if you're getting that sense of instability, your muscles will hold it in. And that's certainly worthwhile to do.
Okay.
Beyond that, it's looking at surgery. Obviously, if you were to give up arm wrestling,
you
wouldn't need to contemplate surgery.
Yeah.
So it really is because I think you'd find that the symptoms would settle down if you weren't pushing it so hard.
Yep. No, that's fine. Yeah, I mean, definitely seeing physiotherapists and getting an active rehab plan to try to stabilize that. Is it, and the swelling around the bicep, is that something that would be linked to that instability, you think? Or?
So I was really expecting your biceps to be symptomatic, and it still might be. We'd have to look at it.
Yep.
I'm not saying it's definitely normal, but
if
you had some tears or tendonitis in it, we should have been able to provoke some pain when we were putting it under tension.
When I've tested my back pressure, which is just in a hammer curl position, directly back pressure, my 1 rep max has gone down without discomfort comes in at around 40 kilos, where normally 55 is my level that I can do. So I could probably push to 55. I could still be strong, but there's just discomfort. So yeah, okay.
Yeah, so the first step in treatment is a proper rehab program.
Yep.
Possibly a cortisone injection to settle things down.
Yep.
And do that for some time. Beyond, if that doesn't work, then what we're looking at is surgery. Surgery takes the form of giving you a general anesthetic, examining your shoulder under a general anesthetic, and see if it is actually subluxing. I think we'll find it subluxing out the front.
Okay.
Be very surprised if that's not the case.
And in terms of now the old question of risk of arm wrestling and continuing, I mean, as you know, I'm going to continue arm wrestling, and I'll listen to my body a lot with where I can arm wrestle safely. What do you see as risk? Is there a risk of a significant or acute injury anywhere, based on what you've seen, if I was to continue?
I think you might find this sense of instability gets worse, and I think you might injure your subscap tendon. It's obviously a little bit unhappy.
Yep. Okay. There we go, YouTube. What are the chances of me stopping arm wrestling? Pretty much zero. But anyway, I will, of course, as I've said, listen. And
I actually feel like I'm becoming a better arm wrestler because of the way that I'm having to avoid this instability at the moment. So, yeah, it's interesting stuff.
So, you mentioned cortisone shot. Is that something that you would recommend pretty much straight up, or?
Yeah, I don't see a problem having cortisone shot.
Because I feel like that'd be curious. I'd be curious to see if that. And then, do I get scans again to see if the bicep swelling, the tendon swelling's gone away, or?
I don't think that'll help us. I think it will be just monitoring your progress.
Okay.
The effusion around the biceps tendon is actually from the joint. You've got a joint effusion which is going down the biceps tendon, because the biceps tendon, that fluid around the biceps tendon is continuous with your joint.
Mm-hmm.
So I think with you it's probably just from the joint.
Okay.
We've been thinking of it from the biceps tendon, which it can be, but in you, because your biceps tendon really doesn't look like such a problem, I think it's just from the joint itself. I think your joint's sore. You see you've got fluid in the joint, you've got another pocket of fluid up near the subscapularis tendon.
Okay. All right. Well, I guess I'll make the cortisone thing happen. Is that a referral from you to get that to happen?
Yeah, we send you down the radar. I'll just do it under office.
We'll do all the admin now, YouTube. We might leave that there, but I can't shake your hand, but thank you very much. I would give you an arm wrestle usually. Have you had an arm wrestle before? You got big hands on you by the looks of it.
I like arm wrestling, but I don't think I'm in your league, mate.
Do you want to have a go?
We'll have a go.
Yeah, right. All right. Let's get the arm wrestle going.
Imagine the irony if Ken was to bust my arm now or something. How many yeah, just across the table. How many surgeries have you seen from arm wrestlers with broken humeruses and things like that?
Yeah, I've seen. There's been a couple around the last couple of years. You're already pulling in closer to.
Yeah. Well, so that's the thing about arm wrestling is novices often instinctively go this way. It's more about bringing someone closer to you, separating them from their power. All right, show me what you got. Oh, he's strong. Yeah, this is good. Nice.
No chance.
And then try to pronate as well.
I'm trying.
Over the top, there it goes. Nice. You're strong, man. That's good. You would do really well in arm wrestling. Legit. You should come along.
I need a beer or two for
Yeah. Because you'll probably get plenty of business from us as well. I think there's.
I can feel you decided to overpower me there. I'm holding, but you're sort of playing with me, and it's just ready to go.
Just giving it a feel because.
Yeah, because I'm used to doing it with my wrist, just pull it in.
Well, you've got.
I used to be a rock climber, so.
Okay. Well, there you go. It was obvious straight away, gripping your hand, that you have a strong hand, and your integrity of your wrist flexion and your rotation. Because rotation.
I was right because you were pulling me that far. I'm up against a professional here.
Good stuff. All right. Thank you so much.
All right.
Thanks, YouTube. We'll leave it there.
You do all the rehab, it'll make you feel better about your shoulder, and if you weren't continuing to arm wrestle, it will settle down.
Yep. So
the problem is, competing at your level, the chance of it settling down is probably around 10-20% or so.
Yep.
And it's just, so it's going to.
So
if you want to compete, it'll come back every time you try and compete.
I know that typically I'll get this from a physical therapist or someone, but is it external rotation that I need to strengthen? Given that I know that I've spent so many hours on internal rotation.
Well, I think it's internal rotation they want to strengthen because they want to stop you from dislocating, so they want to internal rotate your arm. Is why I think about it.
Because that's really
interesting. Physios are the professionals on this.
Because my internal rotation, like any arm wrestler's internal rotation, is in a strength sense, it's huge.
But your subscap is sore.
Yeah. Okay. Wow. So, there you go. All right. Well, I know just for the health of my shoulder, in terms of how kyphotic I am, I need to open up.
So I reckon the key for you is the rehab, get a cortisone. And then you're going to have to try it out. You're going to have to go and compete.
Yep.
And
see what happens.
If you find that you can't compete, then we know what we're going to be doing.
Yeah. All good.
All
Thanks
right.
again.
Good, mate.
Cheers. Alrighty, guys. So I've just had the cortisone injection into the bicep tendon where you saw all of that swelling. Dr. Cutbush gave me the referral. I went downstairs and did that. And I was what I was happiest with was that the surgeon said I don't need surgery. It's always good when a surgeon tells you don't need surgery. You know they're a good surgeon. They've got integrity and honesty. So I really was happy with the outcome of today. Most of all, like we said, the fact that there's the hope that with the cortisone injection and some proper rehab therapy. So
people like Giannis Amelins, people like Lucas Raymond, they're probably going to hit you up real soon to get some to get a program for this. But we shall discuss that later. But anyway, cortisone injection is done in the bicep tendon, and then the doctor there said it's going to take like 3 or 4 days before it really kicks in. And yeah, I'll keep you guys updated. And Dr. Cutbush was like, he wants me to go and test my arm out. He's like, don't hold back. He wants me to actually test it out to see how it goes. He said the stability of the shoulder is not really going to improve, but we can strengthen things. There's no reason for concern that I can't handle the tension under the tendons. It's just inflammation that I'm dealing with. So if it gets worse, then he said we have a look with surgery and check the labrum out and all that sort of stuff. But anyway, good news. The cortisone injection is done, and yeah, good result.
Yes, that's a man!